Hello, I am Florence or Floss Collier Sterner from the class of 1957. Our class started in September 1954. 60 all new high school graduates. We lived in the Horace Avenue Nurses Home. We each had a single room with a closet, sink, and furnished with a bed, bureau, desk, and floor lamp. We could decorate as we wished, and did. Our first 4 months were spent traveling 5 days a week by PTC bus and subway to Temple University. We completed a year's worth of sciences in those 4 months. We could be heard reciting on the bus bones, muscles, nerves, etc. Our classes at Temple were lecture halls and labs with student nurses from all over the city. On Saturday morning, we had nursing arts with Miss Kohler. Saturday afternoon and Sundays were free, except for studying. On returning after Christmas break, all our classes were at Abington Hospital, in the Horace Avenue building or in the hospital classrooms. We were taught by the hospital physicians of their specialties and our clinical instructors. We continued with the nursing arts, learning more each week. Baths, beds, enemas, catheterizations, shaves, meds, shots, IM or sub-Q, CPR, etc. As we learned each procedure, we did it on the wards with supervision by a clinical instructor. Once passed, we could add it to our can-do list. By March, our probie period was over, and we were to receive our caps in our striped uniforms, starched bibs and aprons, and collar. The capping ceremony was held at Abington Presbyterian Church, which we marched to. Our friends and family were there for this exciting ceremony. Our choir had been practicing for weeks, and we sang 3 songs, Jubilate Deo, You'll Never Walk Alone, and St. Francis of Assisi. 52 proud voices. While we sat listening to the speakers, our caps sat on a table in front of us. Soon there were giggles and laughs. A kitten had come into the church and was playing among the starched caps. They would move, and up would pop the kitten. Finally, someone from the education department saw what was happening, stopped the speaker, who was not funny, and removed the kitten so that the speaker could continue. It was a wonderful ceremony. By the way, I proudly wore my cap for the 40 years that I worked as an RN, long after others had discarded theirs. Our class sang so well, we went to Princeton to compete in a choir festival, in our uniforms, carrying our Florence Nightingale lamps. We sang the same songs and won the Talbot Cup. The hospital treated us to dinner at a restaurant on the way home. Now we became juniors, worked many split shifts, 7 to 11 and 4 to 7, with classes in between. Pharmacology was the next big step. It was the smallest, thinnest book we had. Medications had just begun to grow. We had 3 antibiotics and almost no psychiatric drugs. We learned to give pills, liquids, and shots, IM or sub-Q. IV meds for nurses was unheard of. We rotated through specialty courses over the next 2 years, dietary, obstetrics, OR, pediatrics, and psychiatry. We spent 3 months at each specialty, living away the 3 months at Philadelphia State Mental Hospital, Byberry. There we encountered 10,000 patients, student nurses from all over the city, and as always, many challenges. We worked 3 to 11:30 and 11 to 7 and staffed the hospital. Our supervisors were ogres to us at first, and our best friends as we became more confident and better nurses. We often had 12 patients on days, 20 on 3 to 11, and 40 on 11 to 7. We became very organized and efficient, but always caring. We had comradeship with our fellow student nurses. We lived together, worked and studied together. We laughed and cried with each other. We formed a bond of sisterhood. Our senior year, we moved to the Arches, behind the courtyard to the ER. We each had a roommate for the first time. Our hours on duty were decided by the head nurse we were working for. Our class hours were known to her. They were in the afternoon, so that we often worked 11 to 7, class, then 4 to 11, and sometimes 7 to 3 the next day. This was called a complete swing. 24 hours on duty within 48 hours, plus class. That was really tough. 41 of us graduated in September 1957. All passed the state boards, taken in Harrisburg that year by all nurses in the state, over 2 days in December. Our last chance to all be together. We received a wonderful, hard education that took us many places in this world. It was not all work. We partied, sang raunchy songs, drank, dated, had dances, a basketball team, and enjoyed every minute of free time. We all have stories about those times, fond memories of the school, our instructors, and our classmates. It was a wonderful time. We became wonderful nurses. We have never forgotten Abington Memorial Hospital School of Nursing. Thank you.